Good morning and welcome. My name is Rob Simari, and I'm the Executive Vice Chancellor of the University of Kansas Medical Center. On behalf of all of us here at the Medical Center, we welcome you both in person and those of you who are joining us online. Thank you for joining us for this really special meeting addressing the impact of healthcare worker shortages, and more specifically, how those shortages affect individual well-being and our ability to provide care in rural communities. We have many people here with us in person, along with several hundred participating virtually from across the United States. The University of Kansas Medical Center is proud to co-host this important convening of the National Academy of Medicine and the Council of Medical Specialty Societies. Today, we will hear from experts and practitioners across our state and across our country who will share their experiences, strategies, and lessons learned as we all strive to improve the delivery of quality care and support the well-being of our colleagues and our friends. The mission of KU Medical Center is to improve lives and communities in Kansas and beyond through partnership and innovation in education, research, and healthcare. Today's meeting is really a unique opportunity to develop new partners and learn innovative new approaches to improve the lives of rural health practitioners. Across our disciplines, we support the care and health of Kansans and conduct research through programs that leverage technology, community partners, and unique educational models. KU Medical Center serves as the health center campus for the University of Kansas. We have 3 schools, health professions, medicine, and nursing, on 3 campuses here in Kansas City and in Salina and Wichita. Our research enterprise is robust and includes our Comprehensive Cancer Center, Frontiers, our Clinical and Translational Science Institute, our Alzheimer's Disease Research Center, and our newly funded Heartland Consortium as part of the All of Us program. Each of these programs has a distinct and unique research, rural focus. Additionally, our educational programs are recognized as some of the best that support our primary care and rural workforces. Our School of Medicine in Salina, 2.5 hours to the west, in North America. We take 8 students per year who want to train as rural health doctors, and now they do it in a multidisciplinary campus with a School of Nursing in Salina. Our regional campuses are models for rural-based education, and the new Kansas Center for Rural Health in Salina leads our commitment to improving health in rural communities. As we have learned, partnership is the key to reaching our constituents and neighbors across our state and region. Collaboration exists with area community colleges, FQHCs, and community hospitals across our state. Today, we are focused on the current healthcare environment affecting the well-being of all our providers, along with all of those working in healthcare. It is important that we come together to share ideas and learn how to support one another. Attention to wellness has traditionally concentrated on how to make individuals more resilient. Certainly we need those programs, but we know that's not enough. Individuals cannot do it alone. As leaders, we must address longstanding organizational issues, policies, and culture that further compound negative effects on the healthcare environment. We must turn our attention to broader strategies and programs to facilitate work-life integration. I encourage all of you who have joined us today to share your knowledge, offer your partnership, and invite your colleagues and organizations to take part in this movement. Together, we can improve the overall well-being of ourselves, our colleagues, and our institutions. Finally, I want to mention briefly how thrilled we are that KU Medical Center is part of the collaborative. When I first learned of this opportunity, it resonated with our longstanding goal to build and maintain a valued and respected workforce. Focusing on well-being seemed a natural and worthy endeavor to help us continue striving towards that goal. Our campus has embraced our role as a change maker in this work, and we look forward to building partnerships and learning from our colleagues here today. So now I'm pleased to introduce our next opening speaker, Dr. Victor J. Dzau, who will offer some remarks by video. For those of you not aware, Dr. Dzau is the president of the National Academy of Medicine, as he also serves as one of the co-chairs of the National Academy of Medicine Clinician Wellbeing Collaborative, alongside Dr. Daryl Kirch, the President Emeritus of the AAMC, the Surgeon General, Vivek Murthy, and Tom Naska, President and CEO of the Accreditation Council for Graduate Medical Education. Dr. Dzau serves as the Vice Chair of the National Research Council and is Chancellor Emeritus and James B. Duke Distinguished Professor of Medicine at Duke. He is the past President and CEO of Duke University Health System. So again, I want to thank each and every one of you and welcome you to Kansas City. It's now my pleasure to welcome Dr. Dzau. Victor?
I'm excited that the Clinician Wellbeing Collaborative is hosting a meeting in Kansas City on an important topic like workforce shortage and rural health. I'd like to begin by thanking Helen Burstin as CMSS for bringing this crucial topic to the collaborative, and University of Kansas team, my friend Rob Simari and Richard Carentaker for hosting this meeting on their campus. The shortage of healthcare workforce in places that have been the most need is one of the biggest challenges to our healthcare system. This meeting is focused on workforce shortages and healthcare worker well-being in rural settings. It will cover complexity of meeting the need, especially when you factor in things like increased demand for some specialty as the population ages, and the issue of equity and distribution challenges. These impacts can be extreme in rural areas. On top of that, the reality is that healthcare workforce is also leaving the profession. And you know it, 1 in 5 employees have left the organization between 2022 and 2023, and healthcare organizations will see economic costs and cost of patient safety challenges if they don't take action to prioritize their employees' well-being. As many of you know, our collaborative released a national plan for health workforce well-being last year to call for coordinated collective action on this front. We would like to hear from you how this plan can be implemented in rural settings. Important, on year 1 anniversary of the national plan's release, we launched the Changemaker campaign. The goal of this campaign is to recruit a critical mass of health systems, hospitals, practices, academia, professional organizations, private sector, and others that make systems and cultural changes to prioritize well-being. So far, we have more than 250 change makers sign up since we opened the campaign in October, and we're expecting a lot more to join us. So this Changemaker campaign is designed to facilitate information sharing and collaboration of well-being on the well-being initiatives across US, documenting their impact and amplify effective solutions to common challenges. With the NAM serving as a catalytic hub for progress and collaboration, I have the vision for this campaign success over the next few years. We're able to drive change at a key institution that aligns with national plan. So the collaborative will continue to pull in organizers, sign on as change makers, which will declare their commitment to prioritizing healthcare workers' well-being as long-term value. We need institutions from rural areas to sign up. Over time, these change makers will be ready to do more and join the collaborative's cohort of change maker accelerators. So these accelerators are 30+ organizations that are committed now to rigorously drive positive system change at their institution because they are already collecting data, making change and tracking results. And these early accelerated cohorts will provide lessons for the implementation experience as they serve model success for all the others in the campaign. We'll also engage key policy and decision makers. The collaborative will enable connection between policymakers and other health system stakeholders to find solutions that not only manage the current state of healthcare delivery, but also transform healthcare. Lastly, we'll continue to raise the overall awareness of health workforce well-being issues and strategies to the broader public. In that context, we're organizing the inaugural National Day for Healthcare Workforce Well-being in 2024. And we're going to do it with our federal and nonprofit partners. Stay tuned. This day of awareness and action will serve as an opportunity to raise national visibility about healthcare workforce well-being, improve public understanding of challenges, and express gratitude to our health workforce. It will also provide an opportunity for institutions and the public to reflect annually on the progress made advancing the movement to support healthcare workforce well-being. Our work continues after this meeting. I would like everyone in this meeting to discuss the issues that are especially relevant to clinicians in rural settings and actions that can be taken. I would like everyone to think about how they can become a change maker. Join the campaign, no matter where they're coming from. Today, we have the opportunity to learn from creative solutions that rural healthcare leaders have pioneered, often with limited resourcing capacity. Kudos to all of you. Hopefully, this will inspire solutions that you can start driving at your own institution and new partnership that NAM will continue to support and amplify after this meeting. So thank you to the planning committee for putting this wonderful agenda together. Thank you, all of you, for being there. And I want now to turn over to Helen Burstin, who speak on behalf of the planning committee. Thank you.
Good morning, everybody. Really a pleasure to be here with you today. On behalf of the Planning Committee, I just want to welcome you all here in person in this beautiful sun-filled room. Those of you participating virtually are missing this truly beautiful venue. Thank you for joining us today. On behalf of the Council of Medical Specialty Societies, really pleased to co-chair this meeting with the National Academy of Medicine and our colleagues at KUMC. CMSS is a coalition of more than 50 specialty societies working to advance the expertise and the collective voice of specialty societies in support of physicians and the patients we serve. A special shout out to Dan Cole, who's here in this room somewhere, for bringing this issue of workforce shortages and the connection of safety and health healthcare workforce well-being to CMSS in his role as president of the Anesthesia Patient Safety Foundation. We recently had a plenary session. Thank you to NAM for co-sponsoring it at our annual meeting, but it's very much focused on these issues of physician workforce challenges. And we really know this issue needs a much broader lens. We have to think about it in the context of team-based workforce issues. We're really grateful that NAM allowed us to co-chair this important meeting. And thanks to our colleagues at KUMC for bringing a really important focus as well on the rural and the DEI lens to this issue. So with that, if you could just bring us to the next slide. I'm going to walk you through briefly our meeting objectives before I have the honor of introducing our keynote. So today's objectives, we're going to frame, as I mentioned, this healthcare workforce crisis and discuss its implications for the healthcare workforce well-being and access, again, to these issues of safe, high-quality care delivery. And again, this issue of healthcare, of safety, really has become an important issue as you really think about how these issues all get linked. In particular, and again, thank you for our partnership here with our colleagues at KUMC, get a great opportunity to bring in some speakers to help us think about this issue of workforce shortages in the context of rural healthcare settings, and specifically highlight their strategies with some colleagues from out of state as well for overcoming workforce challenges and barriers to healthcare worker well-being. And then finally, thinking about how we can explore successful strategies and solutions to promote health worker well-being, enhance team-based care, and contribute to equitable health outcomes. And as you'll notice, one of our breakout sessions this afternoon is specifically thinking about some of the issues around DEI and providing care to diverse populations across multiple groups. So we're going to, before I introduce Dr. Christensen, I'm just going to a couple of quick announcements. We're going to have a synthesis session planned for later this afternoon. You'll have a chance to reflect on the actionable items. And I think there will be many that'll come out of our discussions today. Each table in the room has a note card to record, this is going to be hard, one big idea for 2024 that you'll identify with your table mates. If someone from each table can nominate a scribe to facilitate that, that'd be great. You can duke it out to figure out who's going to get to pick the one idea, but one scribe. Staff will then collect those cards from you after the lunch break and prepare a synthesis activity that all attendees, including our friends online, can participate in.